Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. It is really give me a lot of pleasure to join you in talking about tobacco addiction. My focus in the next 10 to 15 minutes this time on vaping. Those who attended my talks in the past, I talked about cigarette, shisha, midwah, but today I'm going to focus on vaping. To vape or not to vape. So what's so bad about e-cigarette and vape pens? What I have noticed in the last few months when my patients come and ask, do you smoke? You say, no, doctor, I don't smoke, but I do vape. So majority of people think that vaping is not smoking, it's safe. So really, I think we have to focus on what's so bad about it. In general, 50% of young people who continue to smoke will die from smoking. Almost 100,000 young people globally become addicted to tobacco every single day. The effect of nicotine, we all know it. It's a drug, it is stimulant, it's highly addictive, it causes changes in the brain chemistry, and it's found in all tobacco products. Within a few seconds of taking a puff, whether it's vaping, cigarettes, midwah, or shisha, the nicotine reaches the brain and it goes to the brain to the addictive center. And we know that it's in the midbrain, it's called VTA, ventral tegmental area. And this combination of nicotine, when it reaches the brain, stimulates the alpha-4 beta-2 receptors and releases dopamine. And that dopamine is the pleasure substance. It goes to the front part of the brain and make the smoker feels good. So, but however, it rewires and changes the brain. Within a few minutes or a few seconds, the patient becomes tachycardic, and some of them have trouble breathing. And we know that not a single tissue in the body is not affected negatively by smoking. I mean, we talk about stroke, we talk about aortic aneurysm, we talk about trachea, and so forth. And how about the flavor? See, the tobacco industry realized this is so profitable. And they have special kids menu, believe it or not. And this was shocking to me. And they have over 15,000 tobacco flavors and counting. It's all legal, it's everywhere, and people are free to purchase it. And this is very unfortunate, this is very sad slide. Talk about banana, from honey, from barley, and so forth. Well, there were some literature. We talk about a few of them here. This is in the American Thoracic Society in 2018, a widely used e-cigarette flavoring impairs lung function. And this another article about e-cigarette use flavoring may increase heart disease, and this study found. Furthermore, cinnamon flavors may contain cinnamon aldehyde, and cherry flavors may contain benzaldehyde. I really think all this information should be public. I think we should really make sure with the media, with whoever we can reach out in our community to try to publicize these things. So the effect on health, we know that, right? We know that there are three major killers related to tobacco: the lung, the heart, and the brain. We know that the prevalence of myocardial infarction, coronary artery disease increased tremendously in people who the direct effect of nicotine on the intima. We know that smokers have higher chance of having lung cancer and COPD, and also stroke rate is very high compared to people who do not smoke. Well, furthermore, nicotine in the e-cigarette is not only addictive, it might increase the risk of heart disease, and it might damage the DNA. And by damaging the DNA, it affects the emotional stress. This is from the American Journal of medical community. So how can we summarize the dangerous effect of vaping? For the first time, we have seen vaping device cause sudden, immediate, serious, and sometimes fatal damage to the lung. And the Center for Disease Control and Prevention recommend not to use any kind of e-cigarettes and vaping, particularly from informal sources like family, friends, dealers, online, or other sources. Since these products are not regulated, there is no guarantee that any part of e-cigarette is safe for your health. Your lungs are the most happy and safe when you only breathe in oxygen and clean air. I really think those messages have to be out in the community through our medical, of course, centers, but furthermore through the media. So what the industry is not telling us? How do all of those products affect our body and our community? Well, how about the second and third hand smoking? We remember that from regular tobacco, of course. We know that second-hand smoking, particularly through vaping, nicotine is out in the air, heavy metals, ultra-fine particles, cancerous chemicals, and furthermore. Third-hand smoking, what's the definition of third-hand smoking? You smoke in the room and you leave, and you think that everything is okay if you're not smoking in front of your children. However, 90% of the toxic particles related to smoking, including vaping, do stay on the furniture. And those who are affected, people who are short stature, of course, I mean by short stature, our kids, because they're sitting on the sofa and the carpet, and they are inhaling those toxic particles. And this is definitely a dangerous effect. So typically, the question smoker asks himself, how can I live without tobacco? Snake is a snake. That's my answer to them, whether it's vaping, shisha, midwaf, or cigarettes, or any type of tobacco. Let me summarize in the next few minutes, how can we help those smokers? The approach includes physiological, psychological, and behavioral. As physicians, we are good about writing prescriptions. But what most important thing, behavioral counseling and follow-up behavioral counseling, cognitive behavior. So we either have to develop those skills and apply it, or refer our smoker to a colleague or center with tobacco cessation expertise. So what can we do as busy physicians? What I'm asking most of you who do not have the expertise or time to develop those expertise, to spend 30 seconds with those smokers. Ask, advise, and refer. It has been found that brief interventions is very effective in increase the referral rate by about 55% of tobacco users to tobacco cessation programs. Versus if you do not spend those 30 seconds, only 5% of tobacco users seek help. So really those 30 seconds are very valuable. And usually what we recommend, of course, we do not make the smoker feel guilty. We do not tell them this is bad, you should quit and you should go. We tell them, what do you smoke? If he said no, do you use any kind of smoking, including vaping? He said yes. They said, how about consider tobacco cessation? And at some point, if you're interested, I can refer. So if you put it this way, there is likelihood he will be accepting your advice. So ladies and gentlemen, cessation programs are fully available only in 9 countries with 5% of world's population. And we are lucky that we're living in our beloved United Arab Emirates, and we do have tobacco cessation programs in Dubai, in Abu Dhabi, and in the other Emirates. You just have to look it up. The behavioral change, its roadmap, its 4-point plan, and we are here. So we have to remember that health exists to our patients. So knowing what we do about e-cigarette and considering all the things we don't know about e-cigarette, why do teens choose to use it? Well, because industry want them to do so. But that's why I wanted to send those messages, and I hope everything is clear. And thank you so much.